Okay.
Yeah, yeah,
But the
yeah.
one thing that isn't is the iron issue. So
Oh no,
is
it's related.
okay, you could okay, but I do have a question. The iron issue, low iron affects dopamine, right? And doesn't that contribute to movement disorders like
Yeah.
possibly bruxism
So,
and
so,
sleepwalking? Okay.
so iron is a really important thing for the brain. It's one of its many things as a neurotransmitter. Within the brain, there's a thing called the reticular activating system. It's sort of kind of like your sentry that's sort of in your background, so that when you walk into a house and you've got your alarm system and it notices someone's walked in and it sets it off. Well, this thing is sitting in the background doing nothing until it needs to do something. And one of the somethings it does is when you've got airway obstructions, when it kicks into gear. And its function is reliant on good iron levels. Like brain function is reliant on good iron levels. It's a really important part of it, and it's why we think low iron can manifest as teeth grinding, is because in simple terms, this whole neurology is short circuiting, and the home alarm system thought someone had walked into the house when in actual fact it was just the curtain blowing in the breeze.
So you're saying
It
the low
misfired.
iron triggers can trigger an arousal from
No.
like
The low iron affects brain function. So
okay,
the
and that
brain function is dysregulated. So
okay,
the internal checks and balances are out of alignment, and as
okay.
a consequence of that, we see these neurological manifestations
Mhm.
of low iron.